Welcome back to Great Day Houston. February is American Heart Month, dedicated to raising awareness about heart disease, the #1 killer of men and women around the world. Women oftentimes bug men about not going to the doctor. Well, guess what, ladies? We need to pay attention to our health as well.
Hey, honey. You okay?
Yeah, I'm fine. Mom! I think you're having a heart attack.
Honey, do I look like the type of person who has a heart attack? I'm just gonna sit down. I think I might be having a little heart attack. Just some nausea, tightening of the jaw, dizziness, shortness of breath, muscle pain, achiness, this terrible pressure in my chest.
That is a scenario that's played out again and again and again across the country and even around the world. Don't rely on symptoms to give you a fair warning. In the case of women, symptoms might not be the ones you oftentimes hear about. EMT Teresa Hinojosa and paramedic Angela Hare are with Harris County Emergency Services District 11, and they have a little 411 on some heartfelt 911 issues. Hello there, ladies.
Good morning.
All right, let me start with you. Any history of heart disease in your family?
Yes, my mom and my stepdad both.
Yeah.
Yes.
And my mother had a heart attack.
So you all know, and it's interesting because it's one of those things when we say that heart disease is the #1 killer around the world, people are still more concerned about other things like cancer.
That's right. Sometimes people just take it for granted that, our hearts are going to be okay. We need to pay attention to a lot of precursors that we have and make sure that we take care of ourselves and that we know what our risks are.
Yeah. My dad, it was interesting. He was 80 years old and he was having some chest issues, and he went to the doctor and he left the doctor's office with a prescription. He got to the pharmacy and they went, okay, here it is. He goes, $150. I'm not paying that. I'm going to go to the other hospital. So he went to the military hospital, but he walked in that doctor's office and they immediately took him into surgery, called my mom and said he's getting a quadruple bypass. Now, we don't suggest that you drive yourself to the hospital, but I would imagine that in Harris County Emergency Services District 11, the majority of calls that you probably go to all kinds of things, but a lot of them encompass heart disease issues.
That's correct. We do. We have a multitude of cardiac issues. A lot of them that have to do with congestive heart failure, heart attacks, and even cardiac arrest.
Yeah. Let me back up for a second and ask, what does Harris County Emergency Services District 11 do? We'll see you rolling around town, but have no idea the magnitude of what you all do.
Well, we are covering a district that is 177 square miles, and we are doing 911 calls, emergency calls. So their emergency is, we will respond as quickly as we can to get there, and if you call, it's your emergency, we're going to try to get you to go to the hospital.
Yeah.
Taken care of.
You cover more area than probably any other area, county in the country, right?
As far as ESD 11 we do, as far as an ESD district we do, and we have over 74,000 patients.
Okay, all right. There are a lot of misconceptions about heart disease, and one of them is that it's a men's problem. As we just said, no, it's not. It's 50-50 with women. But also, people think I would know if I'm having a heart attack. The symptoms don't oftentimes present themselves.
That's true, and a lot of times when we think about having a heart attack, we think about the classic signs of crushing chest pain in your arm, shortness of breath. Those are all, they are signs, but those are more in men. Women, their symptoms are more silent, like dizziness, nausea, sometimes it feels like indigestion, just feeling weak or tired. Those all can be signs and symptoms. So we really need to know our family history, we need to know our personal history, we need to make sure that we're following up with our doctors and we're keeping control of things like diabetes and hypertension and high cholesterol. Even things like problems with pregnancy. Women don't realize if they've had previous problems with pregnancy that they are a higher percentage of having a cardiac event later on in life. Same with women in menopause. We don't have estrogen anymore. Estrogen protects our hearts. When we lose that, we are at a higher risk. So people, in the older population.
Yeah, because when you said that, it's interesting because those are things that are unique to women. A lot of the research done on heart disease, unfortunately, has been done just on men. And so some of the things that she just mentioned are unique to women and do impact our heart health.
Right, and like she said, most of the time with a man, he'll say, oh, I've got a crushing pain and he can't talk very well. Well, a lot of times with women, the pain might be in their back, and they're not realizing that it's a heart attack because it's in the back.
Yeah.
So you need to pay attention. If you're not feeling right as a woman, you you might want to go get checked out because you know tell them what it could be.
Yeah. So the first thing to do is don't panic, right? And then when you call 911, one of the things that you have right here, this is what the EKG. So the difference between a heart attack and then a cardiac arrest, right?
Correct. There is a difference. And so with a heart attack, if we go in and we're thinking you're having a heart attack, we're going to hook you up to our monitor here, and we turn it on, and we have EKG tabs. And so we will take those out, and we will put a 12 lead on you, and it'll take a picture of your heart. And then the paramedic can read it to see, and it'll tell what's going on. And a lot of times, but there's sometimes that you can't even see it with our monitor, that you will need to go to the hospital and have blood work done. That's the definitive way to find out.
Yeah, find out that way. But then the other thing we can do before an event like that happens is practice preventive care.
For sure, that is one of the major things. But if you get to a point where something like that does happen, we have a saying in EMS: time is muscle. The more time you waste once you're symptomatic, the more muscle that you lose. And unfortunately, cardiac muscle is not regenerative. So the faster that you can seek help, the better outcome you're going to have.
Time is muscle. I like that. Ladies, thank you very much for what you do, saving lives every day. For more information on American Heart Month, you can visit harriscountyesd11.gov.